Welcome everybody. Thank you very much for taking time out of your busy schedules to come and hear about a recent update on our latest update, if you will, on our North American human influenza, H1N1 as we're now calling it. We're very fortunate to have our State Health Commissioner here to give us an update. So I'd like to welcome
It has just started, so I'm going to let you listen to it just now.
Welcome everyone. It's great to be here in Fort Wayne. I always love to come here, and you have such a great health commissioner. I appreciate working with Dr. McMahan and great medical services here in your county. I'm here today. Governor Daniels, I've been updating our governor every day. Governor Daniels, on his behalf, I'm here. He's asked that I get around the state and make sure that all Hoosiers get the message. As Dr. McMahan said, we have the new virus, and the new name for this is Influenza A H1N1 North America human. It's a mouthful, I know. But we really want to get away a little bit from the swine flu description, because we're not worried about our swine in the state. Folks can eat pork. We've not had any sick animals. This is a new virus, or a novel virus in human beings. We've been concerned for a while. We've been doing planning for a number of years for an event like this. So we are prepared, and we've got great partnerships. I know a lot of work has been done here in the Fort Wayne area. For Indiana, the update, as you all know, yesterday announced that on Monday night we received our first positive confirmed case, which was a student at Notre Dame. That student is doing well, had relatively mild illness, and is recovered. Has been asked to be isolated, because that's what we're asking folks, if they are positive with this, that it's voluntary isolation in their homes, limit contact with other individuals. The good news is that this virus at this point is sensitive to our antivirals. We have the Tamiflu and Influenza, and so far it's been relatively mild disease in most of the individuals in the United States so far. The main thing here, when we have a new virus that has some characteristics that could cause a pandemic, and that's why we're hearing so much about this, because this is showing some evidence of what we know historically about viruses that could cause a pandemic. We do not have a pandemic at this point, but we're trying to get in front of this. I applaud the efforts. I know a lot of messaging has already taken place up here on this. And the main thing, our main defense and our main job is to stop the spread of this particular virus. And the way we do that is that we need every citizen to take this seriously. And the message is simple. It's one that we've grown up with, but we may not always practice. We must wash our hands, and we're really encouraging every Hoosier, wash your hands frequently, and good idea to carry that alcohol-based hand gel. Do that all the time. I've been personally asking, I started yesterday asking Hoosiers to stop shaking hands, and I'm out promoting elbow bumping or bowing or something like that to greet, because it'll just make it a little easier. You may not have to try to wash those hands quite as frequently. Because imagine when you're in a social setting and you're shaking hands with lots of different people, and you don't stop to wash your hands. So that's why I'm asking for that. Then if folks have to sneeze or cough, please have tissue. Do it in the tissue, because you can imagine when you cough or sneeze, and the propulsion of those viruses are going to go farther, and you may infect other people if you are in fact carrying anything. And this is the same message we give for seasonal influenza or the spreading of just the common cold. Imagine if we practiced these things diligently, we would cut down a lot of illness all year long. So we are asking folks to do that, and then after you toss that tissue, wash your hands very well. Now the third thing we're asking individuals, and this is very, very important, if you have influenza-like illness, if you have symptoms of the flu, and those symptoms are fever of 100 degrees or more, 100.4 or more, and then symptoms like headache, sore throat, cough, body aches, or fatigue, if you have those symptoms, we would ask that you stay home. And if you have mild symptoms, if those are mild, it looks like you may have the flu, stay home and call your physician, because we don't want to overwhelm the medical community. Call your physician to report what your symptoms are. All physicians in the state of Indiana, along with our dentists, our pharmacists, our veterinarians, and our nurses, will all send a communication from the State Department of Health first thing Monday morning, giving them the case definition and what they should look for. And so folks with symptoms, and then plus if they have, if they've traveled to Mexico or to one of the countries where we've identified this virus, or they've been in contact with someone that's ill, the physicians know what to do. Those individuals we want tested right now, because we're still trying to understand what this virus is going to do. Influenza viruses are notorious for changing, and that's why, because this is a new virus, we don't yet know exactly how it's going to behave. There are also a lot of unanswered questions we've seen out of Mexico, stories about more serious illness. In the United States, again, the majority of the cases have been mild, although we are beginning to get some reports of more serious illness. So those are the basic messages that we need all citizens to follow. Now, I think this is also a great opportunity, and we want everyone, now's the time for everybody to just understand these basic public health. It's a defense. This is your defense against disease, and we're all in this together. We need to stop this virus from spreading. In the meantime, some things that you can do, and a great time to think about, if you're 65 years or older and you have not had a shot for pneumonia, which is the Pneumovax. If folks get the flu, you have a higher risk of pneumonia. It's a one-time shot in your lifetime, but if you're 65 or older, you should get this. Talk to your doctor about getting it if you've not had that shot. The other thing are individuals from age 2 to 64 that have chronic disease. They might be a candidate for that pneumococcal vaccine as well. Talk to your physician. Is this a good time? It's always a good time to get this shot, because this is good prevention. And again, just one time in your lifetime. The second thing that I want to remind everyone of, and this we've not heard a lot about, but when children have the flu, we do not want to give them aspirin. There's a syndrome called Rye syndrome, and so, now we don't hear a lot about it because we use Tylenol a lot for fever in children. That's the reason for that, but just a reminder now with this, please don't give aspirin to children that have flu-like symptoms. We have started at the state some hotlines for citizens that have a lot of questions. As more media is covering this, folks have questions. They're not sick, but they have those questions. And so hotlines have been set up at the state. Citizens can call 877-826-0011. And then we've also set up a hotline for physicians or care providers that may have clinical questions so that we can answer those. And that's 866-233-1237. We also are enhancing our website. So we have a number of things underway right now to try to help limit, right now, it's all of us together limiting the spread of this new virus. So with that, let me introduce my colleague, the Executive Director of the Indiana Homeland Security, Joe Wainscott, great colleague, and I'm glad to have him